There's no better feeling than a personal win, and the State Farm Personal Price Plan can help you do just that. Talk to a State Farm agent today to learn how you can bundle and save with the Personal Price Plan. Like a good neighbor, State Farm is there. Prices are based on rating plans that vary by state. Coverage options are selected by the customer. Availability, amount of discounts and savings, and eligibility vary by state.
Welcome to Bytes of Health, where we hope to take a bite out of your parent worries each day with sound advice and guidance. Every morning, we'll answer a commonly asked pediatric question in 5 minutes or less. I'm your host and public health scientist, Dr. Jess Steyer, and today we are going to talk about bedwetting. The clock is ticking, so let's get to it. Now, I don't know about y'all, but my kids, one in particular, struggled with bedwetting for a few years. So this is something I've experienced, something I've lived through. And if you're dealing with this now, know that you are definitely not alone. So what is bedwetting? How common is it? Let's get to it. So bedwetting, or as it's known clinically, nocturnal enuresis, refers to involuntary urination during sleep in children who are old enough to be expected to control their bladder. So it's important to know that it's considered normal up to age 5 to 7, depending on the child's development. About 15% of 5-year-olds, for example, wet the bed. By age 10, this drops to 5%. It's more common in boys than girls, and bedwetting often runs in families. So these statistics show that bedwetting is a common childhood issue that usually resolves with time. So what causes it? Several factors can contribute to bedwetting. Delayed development of bladder control, deep sleep patterns, making it hard for the child to wake when the bladder is full, smaller than average bladder capacity, overproduction of urine at night, let's say due to low levels of antidiuretic hormone, which occurs occasionally in some kids, constipation, which can put pressure on the bladder. Now, in rare cases, underlying medical conditions like diabetes or urinary tract infections may lead to bedwetting. And also stress or changes in routine. It's important to remember that bedwetting is not the child's fault, and it is not caused by laziness or defiance. That being said, again, as a parent of a child who did wet the bed there for a couple of years, I know that it can be frustrating for a parent because you wake up, you go into the room, you have to pull all the sheets off the bed. I did invest in one of those mattress covers that's waterproof, and that saved me from ruining the mattress more times than I can count. So when should parents seek medical advice? While bedwetting often resolves on its own, parents should consult a doctor if the child is still wetting the bed after age 7, if a child who's been dry for several months suddenly starts wetting the bed again, if the bedwetting is accompanied by other symptoms like pain when urinating, unusual thirst, or daytime accidents, if the child shows signs of stress or anxiety due to bedwetting, or if there's a family history of prolonged bedwetting. A medical evaluation can rule out underlying conditions and provide guidance on management strategies. Are there treatments available? So treatment approaches for bedwetting include behavioral modifications primarily, so things like limiting fluids before bed, scheduling bathroom trips, and using bedwetting alarms. Now, we do have a system in our house, so after the kids brush their teeth, they know that it's time for them to sit on the potty, empty their bladders. So we make sure to build that into the nighttime routine. You can also use motivational therapy or positive reinforcement and reward symptoms. Now, in some cases, doctors may prescribe medications to reduce urine production at night or increase bladder capacity. If constipation is the issue, you may want to address constipation if present. So you can try things at home, like having your child have fruits or prunes or things that help with constipation. And there are also some gentle medications that your pediatrician can recommend as well. Now, If bedwetting is causing emotional distress, the best approach will really depend on the child's age, but counseling may be beneficial. It also relies on things like frequency of bedwetting and any underlying factors. It's really critical to work with your child's healthcare provider to develop an appropriate treatment plan. So how can parents support a child who wets the bed? You certainly want to remain patient and understanding, avoid punishment or shaming, which can exacerbate the issue, ensure that the child understands it's not their fault, involve the child in the cleanup process without making it feel like a punishment, use waterproof mattress covers and absorbent underwear to minimize disruption, celebrate dry nights, but not overemphasize them, maintain open communication about the issue, and encourage good toilet habits during the day. Remember, most kids eventually outgrow bedwetting. A supportive, patient approach can help manage the issue while protecting the child's self-esteem. All right, well, I hope you learned something, and we have lots more to share. You can get your Bite of Health every day, Monday through Friday. If you like what you've heard here, please let us know. Leave us a review and be sure to tell your friends. Remember, there's no single or best way to parent. Parenting is a journey, and we are all just doing our very best. We wish you happy, healthy, and stress-free parenting.
If you're listening to this podcast, then we know you love learning. So let me tell you about Airwave History Plus, now available on Apple Podcasts. Airwave History Plus is your ticket to ad-free listening, bonus content, and early episodes from dozens of the most popular history podcasts, including History That Doesn't Suck, The Explorers Podcast, The History of World War II, Queen's Podcast, The History of Egypt, The Age of Napoleon, and more. For your free trial, search Airwave History Plus on Apple Podcasts and hit subscribe. That's Airwave History Plus, available now on Apple Podcasts. Airwave History Plus, the essential audio destination for history lovers.